USMLE Forum of Pakistan, continuing on with USMLE Step 1 Neurology Question Bank. And here we go. So, not a difficult concept, but a question with vocabulary that you might see in the paper. So, this is some important diagnoses, some important vocabulary that students typically get confused in. And this is very important to know, high yield information. So, highlighting the important clues in the question, there is motorcycle trauma, and the patient was previously healthy. He's intubated. The GCS is low, and he has a variety of features of trauma, edema, hematoma, fractures. So he undergoes craniotomy, and he's admitted to the ICU. So over the next 15 months, the patient has improved. He's extubated already, which means he's breathing spontaneously. And the patient opens his eyes. He has random gaze, and the pupils are reactive, which means the pupillary reflexes are preserved. He does not follow, vocalize, or follow commands, and he's moving all four extremities. Important, he does not withdraw from pain, and he has incontinence, urinary and fecal. So you must understand that what can we call a patient that is neurologically all right, physiologically all right. In terms of medicine, as far as medicine is concerned, he's breathing spontaneously. He has no problems. He's not paraplegic. He's not paralyzed. What is it? What are the features that we can use to diagnose this pathology, which is seemingly all right on the surface? Well, you have to understand that number one, there is no neurological problem. He has spontaneous breathing and spontaneous eye movements. So eye reflexes and breathing is preserved. He's not talking or listening. And that's number two. He has random, non-purposeful movements. Number three, he has fecal urinary incontinence. Number four, and he has a history indicating brain trauma. Number five. This kind of a patient is in a persistent vegetative state. Now, explaining other options that will make this clear, the difference between them, is that brain death, tangentially, in contrast, is the wrong answer, because in brain death, there will be neurological deficit. What would happen is there will be no spontaneous breathing, no brainstem reflexes, no reflexes at all, no pupillary reflex or corneal gag reflex, any reflexes that. There will be no motor responses. There will be no movement. Even the patient will not move it randomly. He will not. And there will be a flat EEG, an electroencephalogram. You have to remember that this is a very important condition, that EEG will be flat. The patient will be classified brain dead. Again, repeating, when he will not spontaneously breathe, he will have no reflexes, he will have no motor response, and he will have a flat EEG. Locked-in syndrome is also quite similar to brain death in the fact that there will be motor paralysis. There will be quadriplegia, paraplegia, but he would be neurologically fine above the pons. So it is heavily associated with pontine hemorrhage. And what happens is that the patient is quadriplegic and he cannot move any of the muscles, any of the limbs. The only movement that is preserved is vertical eye movements, which means he can move his pupil up and down. He cannot move it from left to right. So there will be no horizontal movements. There will be just up and down pupillary movements. It will present as a patient that is stuck in a barrel, that is locked in a barrel, that he cannot move his limbs and he cannot move his eyes side to side. What he can do is just move his eyes, his pupils from up to down, top to the bottom. He would be, however, conscious and aware. So this is where brain death and locked-in syndrome differentiate, is that there will be no EEG flatlining or no lack of reflexes, all of that would be there, right? This is where they differentiate. Cataplexy, on the other hand, is strongly associated. This is basically a condition that is strongly associated to narcolepsy. Okay, narcolepsy in which there is excessive daytime sleepiness. What happens is that whenever there is a sudden surge of emotions, the patient suddenly loses all of his motor control, muscle tone, and he just goes limp. Basically, a patient starts to laugh. He gets surprised. This might present as a patient's friend surprises him with a gift. The patient suddenly falls into an episode of cataplexy. He just falls to the ground. He goes limp, and that would be a strong clue of cataplexy. These are episodic, and there is no loss of consciousness. Patients are aware. They will fall down. They would go limp. They would be aware of that. So that is what good. That's what's going to differentiate it from a seizure. A seizure, the patient will not be aware of the situation. And of course, as I said, it's heavily associated with narcolepsy. So there would be extreme daytime sleepiness. The history will be there in the question. So you have to keep an eye on that. Selective mutism is a psychiatric condition, mostly presents in pediatric patients in children, but can present in adults. What happens is that the patient is aware, he's conscious, he's not in a coma state, he's not having any incontinence, he's not having any motor deficit. What is happening is he's mute. He chooses not to speak in certain situations or in all situations. Basically, they will give you a child who chooses not to speak at the school. He's fine at the home. He can speak with his friends outside of the school, but at school, he has no friends and he chooses not to talk. He chooses not to answer. They confuse you with auditory problems. They would say that they would ask you what is the next best step, and they would confuse you by giving you an option that check the hearing of the child, which is the wrong answer. Because mostly patients with auditory deficits will also present as patients who refuse to speak or answer questions. So they might confuse you with that. But the patient, it would be mentioned in the question that the patient has preserved hearing. The patient is absolutely all right in the hearing department. So then you would go towards the selective mutism part. The patient will not have any traumatic history or any association with any kind of loss of reflexes. Okay, so you have to remember high information. So consolidating, brain death, no brain function at all, no breathing, no reflexes. Cataplexy associated with narcolepsy, and is brief episodic, uh, associated with a surge of emotions. Locked-in syndrome, fully conscious but paralyzed except for the vertical eye movement. Persistent vegetative state, wakeful, he's awake but he's not aware. Like you're taking out the soul from someone's body. So the person is awake but is not aware. Selective mutism, psychological, has no neurological damage. Persistent vegetative state also has no neurological damage, but brain death has neurological damage. All right, that's it.